Welcome to Impact OC, the only program showcasing the people and organizations shaping Orange County. With your host, Dawn Camber.
Hello, I'm OC Talk Radio Public Affairs Director Dawn Camber with another great guest impacting our community in a positive way. Today, I welcome American Heart Association Orange County Board Chair Angela Ahmad. 5 years ago, her 6-year-old son had open heart surgery after a routine checkup. That experience made her want to get involved in the nation's oldest volunteer health organization that aims to fight heart disease. Thank you, Angela, for being on Impact OC.
Thank you, Dawn, for having me. Nice to see you again. And thank you so much for your continued support of the American Heart Association and helping us fight heart disease.
Well, thank you for that. Angela, please share with us your story about your son's health crisis.
Yeah, so thanks for letting me share my story. As you mentioned, 5 years ago, during a routine checkup, having vaccinations, our pediatrician noticed my then 6-year-old son heart was beating, was making a different sound when it was beating, and he recommended that we go and see a cardiologist. He had detected a slight murmur when my son was a baby, so and said we just monitor it. And so I expected that this would just be kind of a really boring trip to the cardiologist, and didn't really think much of it. We made an appointment, and after an hour at the cardiologist's office, I realized there was probably something more going on than just a routine murmur. A few tests later, over the course of a few months, my then 6-year-old was diagnosed with a very rare congenital heart defect called scimitar syndrome. In layman's terms, which is about all I'm medically qualified to provide, it means the plumbing was going to the wrong place in his heart. So one of his pulmonary arteries was attached, or pulmonary vein, sorry, was attached to the wrong place. The good news is that it was completely curable, fixable. The bad news was it required open heart surgery. So last September of 2016, he went in for open heart surgery. They stopped his heart for about an hour, cut the errant vein and attached it to the left atrium of his heart where it should have been all along, and sewed him back up. And they did all of this with the bypass machine that funding from the American Heart Association helped develop many, many years ago, and using his own heart tissue. So really miraculous what our doctors can do. And he's back to playing sports and really has made a full recovery. So we're so thankful that that he had a successful outcome, but just being in the hospital and seeing, we saw so many little babies and newborns with really, really critical and really just, it's amazing, all the defects that children can have, the variety of congenital heart defects, and it really helped put it in perspective for us how lucky we were, and just, again, how amazing technology is, and our doctors and healthcare providers.
Is he going to have to be carefully watched the rest of his life because of what happened as a child?
He is monitored still by his cardiologist, but the amazing thing is we're down to about once every 18 months that he has to go for a visit. He will have to have continued imaging over time. There are risks that even though they call it, and we hope it's a one and done, so we hope that there's no more surgery required for him. There's always the chance when you cut a vein and reattach it that something can happen later in life that requires it to be fixed. But again, there are many children who have issues that require multiple surgeries throughout their lifetime, and we're really thankful that hopefully his was just that one procedure. But and he was able, thankfully, to return to normal sports and normal activities, which isn't always the case for people. So we're really, really thankful for that.
But it was enough to get you involved with the American Heart Association.
It absolutely was. I had already been volunteering slightly, trying to get more involved with them, but really when this happened, it was my double down to really get more involved with the organization again. It's so science-based, and the research from the American Heart Association and the funding is really what's helped transform so many lives around the world.
So what is American Heart Month and its primary goals?
So American Heart Month, well, just to take a step back even, I know you mentioned at the beginning that the American Heart Association is one of the oldest volunteer organizations in the world, and we're coming up in a few years on our 100-year anniversary. So it was founded, the American Heart Association, in 1924 to educate professionals and the public. And along those lines, back in late 1963, President Johnson recognized, then President Johnson, that heart disease, cardiovascular disease, was killing half of Americans. And in response to that, he did a federal proclamation that February, starting in 1964, that the month of February would be designated American Heart Month. And the focus of that's really just to spotlight heart disease, cardiovascular disease, bring awareness, things that we as individuals can do to help really prevent one of the most preventable diseases that's still taking so many lives in our country. We've made huge progress since 1964, but there's still almost 18 million deaths every year as a result of cardiovascular disease. And if we don't get this reined in even more, that's projected to go up to 23 million by 2030. And with COVID and a lot of other things really causing some setbacks, you know, I think it's time this year of all of the years since 1964 to really pay attention to Heart Month and to what this awareness means to each of us.
Well, what can each of us do to prevent heart disease?
Check in with your doctor. Get definitely, first and foremost, I know the system is, people feel like the system is overwhelmed right now, but do your regular checkups, be in tune with yourself, eat healthy. The AHA sponsors a lot of healthy eating months, awareness. There are a lot of materials for healthy recipes. Exercise, we know, is really important, and something that the AHA is really making a priority here locally and nationally is brain and mental health, and really the impact that brain and mental health has on our heart is something that we need to pay more attention to. Stress, we know, can cause blood pressure to rise. We know that blood pressure is referred to as the silent killer. A couple of years ago, the Heart Association, in connection with a number of medical organizations, actually changed blood pressure guidelines. And so a big part of the last couple of years of advocacy for the American Heart Association has been getting the public more aware of blood pressure, learning what your numbers are, check your blood pressure regularly, even if you don't have access to a doctor. Just be aware of what those numbers are and how you can control them. And if your numbers are high, make sure you seek help. And that help may include eventually having to go on medication, but we really want to just bring awareness to everyone and help. There's no secret bullet, I guess I can say, to solving heart health, but there's so many things we can do to really help prevent a major catastrophe in our lives.
And it can easily start with just having a blood pressure test that many people get at doctor's offices.
That's correct. And with the pandemic and people doing a lot more telemedicine, it's a lot harder. I recognize for people to get into their doctor and get their blood pressure checked. Not everybody has access to monitors at home, but there are different ways in the community, at health facilities, at urgent care, at clinics to make sure and keep those numbers in check and know what your baseline is, and therefore you can tell when maybe you're moving in the wrong direction potentially. The American Heart Association did launch in response to the pandemic a Don't Die of Doubt campaign, because they're seeing, and our doctors are seeing this, so many patients are so afraid to go to the hospital or seek medical care for stroke, heart attack, or other cardiovascular incidents. And we really, as an organization, are pushing people to take control and don't be afraid to call and reach out and go seek help if you do need it. urgently, or because your blood pressure you're having other symptoms. If it's not urgent, call your doctor. If you don't have a doctor, find a facility that you can go to get the help you need.
What are some of the warning signs?
The warning signs of heart attack?
Disease. Yeah.
Or heart disease? Yeah, I mean, it depends, and that's a good segue into the Wear Red Day and Go Red for Women. But I think most people think of the classic symptoms, which are sometimes more male dominated symptoms of chest pressure, shortness of breath. Sometimes people will say it feels like there's almost like an elephant standing on their chest, but there can be more subtle symptoms, and those symptoms can also be symptoms of other non-life-threatening diseases, but jaw pain, arm pain, shoulder radiating down the arm. I mean, some women describe just a feeling of general unease or unwellness, nausea. So you can see that it really runs, it can run the gamut of, again, the classic kind of, oh my gosh, massive pain in my chest, to I feel just maybe like I ate something not so great, maybe I have the flu. And that's been one of the big challenges over the years that we've been trying to address as an organization, in particular, is that women do tend to mimic more flu-like symptoms than some of the classic, I'm having a heart attack, male symptoms, and they get overlooked and missed, and ultimately perish because they're not treated for the heart incident that they're having at the time. So the education around women's symptoms in particular has been really critical to getting more women treated timely.
To your knowledge, is there an age too young to get these symptoms?
No, we have so many stories of women in their 20s and 30s and 40s who have massive cardiac events, heart attack, cardiac arrest, stroke. So no one is too young or too old to have symptoms occur. And really, it's just never be afraid or embarrassed to call and seek help. The worst thing is the best thing that can happen. They send you home without having anything wrong with you, and you carry on. But you don't ever want to make, again, that mistake, dying of doubt, that you think it's food poisoning or something, and it turns out to really have been something horrible. So we really encourage people, even in a time of overloaded healthcare systems, to take care of yourself and not be afraid to seek help if you need it.
Which brings us to awareness, which is what we're all about. National Wear Red Day. Explain.
So it's always the first Friday of February, and it was really tagging on to American Heart Month, was put in place probably a couple of decades ago to bring awareness really to women's heart health, and for men and women across the U.S. to show their support for women. And so we ask that everyone around the U.S., and especially here in Orange County, Inland Empire, Coachella Valley, where I'm supporting the American Heart Association, if everyone could wear red on February 5th, the first Friday of February, and think about all of the women in your life. What we know is that, unfortunately, cardiovascular disease is still the #1 killer of women. It kills more women every year than all forms of cancer combined, notwithstanding the awareness, notwithstanding all of the, again, great strides we've made. There's really still so much more to do. And I know from personal experience what cardiovascular disease can do to women, as my mother is I guess now 18-year or 15-year, 16-year, I guess my math is off, heart attack survivor. So she had a massive heart attack at the age of 62, the perfect picture of health. Just was out playing tennis, thought she was having sort of coming down with a cold, going back to women's symptoms, and went home, took a shower, and her symptoms kept getting worse. And by the time she got to the hospital, she had to be rolled into emergency quadruple bypass. She had a tiny little thread of one little bit of blood flow still going through her body. That was it. She was all for her main arteries were completely blocked. So she was one of the fortunate few who survived a massive cardiac incident outside of the hospital. But it can happen to anyone. It doesn't matter if you're overweight, underweight, healthy, exercising, eating right. I mean, all of those things will help, but you really, we have to do more as a country for women's health and for cardiovascular disease overall. At 80% or so of all of cardiovascular disease is preventable. And we really need to make sure we're doing as much as we can to prevent it.
So what are you doing advocacy-wise, nationally and locally?
So locally, we've done, I think, a lot of great initiatives in our communities. Our community impact group is fantastic. They've focused, and every group around the country will have slightly different focus areas. But for us here, we've been really focused on excessive sugar. The American Heart Association for a long time has been highlighting the impact that excess sugar, sugary beverages, those sorts of things can have on obesity, even mental health, heart health. And so there's been a lot going on, bills and legislation trying to figure out how to regulate or maybe tax sugary beverages. And while that hasn't all panned out the way the American Heart Association would like, we're going into the communities and working with them, notwithstanding, to figure out how they can help combat excess sugar and teach local communities about better choices and try to make sure that stores have better and healthier options available, even just sometimes working with stores about where they place certain items in the store, maybe incentivizes people to buy or make better choices. One of the bigger areas, both locally in the state of California and nationwide, that's probably picked up a lot of attention is around tobacco and vaping. The American Heart Association has been really vocal at trying to eliminate the ability to sell those bubblegum and fruit flavored pods that are really, really attractive. They've shown to underage children. Not to say that grown adults don't like bubblegum flavored tobacco also, but the predominant, what I think the studies are showing are that most of these really childlike flavored pods are being consumed by those that you would think under the age of 18, under the age of 21. And that's having a huge negative health impact on our teens, both their ability to focus, their health, lung issues, heart issues. And so the American Heart Association has been a very strong advocate in the state at trying to eliminate those. It's under challenge right now by the tobacco companies, but we're confident and hopeful that that will end in the right place there. And then I mentioned earlier about blood pressure, and we're continuing to do a lot in the communities, working with clinics and other community partners around target blood pressure, helping educate about their numbers and just trying to get them to do more blood pressure screenings and also do them correctly and teach others if they have kits at home how to do that blood pressure check at home in the right way so that you make sure your reading is actually accurate. You'd be surprised at how many people don't do their blood pressure, don't check it correctly, even in the doctor's office.
Well, if they go to your website, they can get educated on this, right?
That is correct. Yes, at www.heart.org. You can find so much information on all of this. Yes, exactly.
And what age is a good age to start teaching people about the importance of taking care of your heart?
We start at the American Heart Association in grade school. So we have a kids heart challenge that is a fundraising, but also educational effort through our elementary schools. And it goes, they kind of change the name and a little bit of the tactics, but all the way through high school. So we start as early as we can to educate students and try to rally them around a cause about the impacts of the negative impacts of tobacco, the positive impacts of being kind. because again, back to the brain and mental health, studies have shown that being kind helps reduce stress, which we know will help improve heart health. So just really, it's a great campaign, and it's never too early to start thinking about that and educating all of those around us about heart health.
Is your son involved with the American Heart Association?
He is, not always. He's 11 now. Not always super super willingly. He's a little bit shy, but at his school has participated in the Kids Heart Challenge over the years, and he's actually stood in front of the school a few times and said a couple of lines, sometimes bolstered by his brothers and some of his friends who've helped out. But he recognizes, as much as he hates that I force him to do some of the events, that it really is, he's fortunate, and that it could have happened, what happened to him could have happened to anyone. And the more time I spend within the organization and the community, the more people I meet who are differently but equally impacted, either their child or a loved one, a parent, by heart disease. Again, 1 out of 3 women are going to be impacted by cardiovascular disease. We spread that out to children and men, and we're all really touched by it one way or the other.
When we go to restaurants, we often see next to the meal that there may be a little heart. Does that mean that it's a Heart Association approved item?
That's a good question. I don't know of that many places where the American Heart Association has an official designated heart healthy, but if they ever did, it would likely look like the American Heart Association's logo and would have a tagline on it. So some of those with the heart on it might be meeting some other standards or similar standards to the AHA, and generally those should be items with lower fat, lower sodium, and just generally and lower calories, so better for you, even if they're not fully designated by the AHA.
Thank you, American Heart Association Orange County Board Chair Angela Ahmad, for being on Impact OC. And I thank everyone for tuning in. I'm OC Talk Radio Public Affairs Director Dawn Camber. Have an impactful day.
You've been listening to Impact OC, the only program showcasing the people and organizations shaping our community. Right here on Orange County's only community radio station, OC Talk Radio.